Bismillahirrahmanirrahim. Assalamu alaikum. My name is Fiza Ahmed. I am student of BDS first year. So today the topic is the synthesis of the vitamin D3 and the regulation of calcium and phosphate ion within our body. Um, so there are three important hormones of the endocrinology, which are the vitamin D3, parathyroid hormone, and its function is to elevate the plasma calcium level, and the calcitonin, which is antagonist to the parathyroid hormone. Within our throat is the presence of the gland known as the thyroid gland, and on the thyroid gland is the presence of the small glands known as the parathyroid gland. And as the plasma calcium level decreases, this parathyroid gland got stimulated, and the release of the parathyroid hormone occur. And the parathyroid hormone will occur on different things. The first one, it will act on the bone and break the bone matrix to release the calcium and phosphate into the plasma and elevate the calcium and phosphate level of the plasma. And the second is the it will act on the kidney, basically the enzyme known as the 1-alpha hydroxylase within the kidney, which is important in conversion of 25 hydroxy cholecalciferol to the 125 dihydroxy cholecalciferol. But first I will explain that how the synthesis of vitamin D3 occur. The synthesis of vitamin D3 start within the skin, because within our skin is the presence of the chemical known as dihydrocholesterol, and as the sun rays hit the skin, this chemical got converted into the cholecalciferol. Then this cholecalciferol within our liver got converted into 25 hydroxy cholecalciferol, and the conversion of 25 hydroxy cholecalciferol to the 125 dihydroxy cholecalciferol is mediated by the parathyroid hormone by the action of 1-alpha hydroxylase enzyme. The active form of the vitamin D3 is 125 dihydroxy cholecalciferol, which we can call as the calcitriol. And the calcitriol will also act on the different things. First, it will hit the parathyroid hormone and it will exert the negative feedback on the parathyroid hormone. Then it will act on the bone, and on the bone it will break the bone matrix to release the calcium and phosphate into the plasma and elevate the calcium and phosphate level of the plasma. It will also act on the GIT and increase the absorption of calcium and phosphate ions. Calcitriol will act on the kidney itself, and I will explain it by considering the functional unit of the kidney, which is nephron. So here is the structure of the nephron. This is the proximal convoluted tubule PCT, loop of Henle, distal convoluted tubule DCT, and the collecting duct. This calcitriol will act on the proximal convoluted tubule and increase the calcium level of the plasma. And the parathyroid hormone will act on the distal convoluted tubule, and it will also cause the reabsorption of the calcium from distal convoluted tubule and elevate the calcium plasma level. Now I will explain that how this parathyroid hormone elicits its effect on the bone and regulate the level of the calcium and phosphate ion within our body. So here is the osteoblast, which is the immature cell of the bone, and on the surface of the osteoblast is the presence of the parathyroid hormone receptor. There are two functions or the two effects which are exerted by this parathyroid hormone on the osteoblast. The first one is the proliferation of the cell, and the second one is the attachment of the receptor known as the rank ligand receptor. The pre-osteoclast is the immature cell, and on the surface of the pre-osteoclast is the presence of the rank receptor, and as the rank receptor of the pre-osteoclast uh, joined with the rank ligand receptor of the osteoblast, then the proliferation of the pre-osteoclast occur to convert it into the mature osteoclast. And the second chemical, known as the macrophage colony stimulating factor, also participate in the further proliferation of the pre-osteoclast. So rank ligand and the macrophage colony stimulating factor, these two chemicals involve in the proliferation of the pre-osteoclast to the mature osteoclast. This mature osteoclast is the multinucleated and macrophage in its action because it is proliferated by the macrophage colony stimulating factor. So, here is the simple structure of the bone, and on the surface of the bone, this mature osteoclast will release some chemicals like HCl on the surface of the bone and cause the resorption of the bone, and as a result of this resorption the breakage of the bone matrix will occur and the calcium and phosphate ion will move into the plasma out of the bone, and as a result of this blood calcium and phosphate level will elevate. So here I have explained you about the synthesis of vitamin D3 and regulation of the calcium and phosphate level within our body. Thank you.